Be aware of some of the commonest sports injuries by which we can prevent the risk or any kind of threatening effect that we get from all these sports. Hi, I'm Dr. Tahmina, your physio fitness and rehab expert. And as we all know that any kind of sports, participating in any kinds of sport, any one sport or more, it's always a vital part of our day-to-day routine because it's very good for our health as well as fitness. So any kind of sports, like if you are involved in it, without saying it goes that there's some kind of risk factor involved in it because there are risk of injuries with any kind of sport. Saying that's very good for our health, it's good for our heart, it's good for our lungs, it's good for our muscles, our musculoskeletal system. It helps to build up our muscle as well as to maintain that muscle mass by doing or playing any kind of sports. But it goes without saying that all these sports comes up with some kind of risk of injuries. Be aware of some of the commonest sports injuries by which we can prevent the risk or any kind of threatening effect that we get from all these sports. What is strain? Strain comes with the muscles. The muscles might get injured or inflamed. The commonest strains being a hamstring strain, quadricep strain, we keep hearing. So that is strain is of a muscle. And sprain. Sprains are with the ligaments. Like ligaments are the structures, soft tissue structures, which will connect two bones together. So it's a part of the joint basically. It gives us stability to the joint because it's connecting two bones together, the ligament. And any kind of sprain in the ligament then automatically takes quite a long time to heal. So it needs proper rehab by which we can heal sprained or as well as a strained structure, which is very important. And like the common conditions that we get because of the sprains and strains is you have heard of some conditions like tennis elbow, you have heard of some conditions like golfer's elbow. Now you need not play tennis or a golf to get a golfer's elbow or a tennis elbow. Like this is a condition which we get in housewives also. So they are not playing any kind of sports. If they are not, then still they are getting all these conditions. So you need not play any kind of game to get all these tennis elbow or golfer's elbow, but still like these are basically the inflammation around the elbow because of your game itself. If there's a repetitive strain which falls in the elbow structures, the soft tissues, the ligament or the muscle around the elbow, we get these kind of laterally. If we are getting, we say it's a tennis elbow, and if it's medially internally, it's a golfer's elbow, which is very common in sports. We also get rotator cuff injuries. Rotator cuff are the muscles, like a group of muscles which help in the rotation, internal and the external rotation of the shoulder, which comes with all the sports like throwing, overhead activities. It needs a lot of rotational movement. So that also might get involved. So we say it's a rotator cuff injury. Lower extremity, like certain conditions we have heard of, the jumper's knee or like these kind of conditions like plantar fasciitis and all. So in jumper's knee, what happens is that the patella in the knee gets inflamed, like above the structures, the muscles which are connecting the patella to the thigh, that gets inflamed sometimes, which we say patellar tendinitis. That might cause some kind of discomfort to the player. It happens mostly with like too much of jumping or running activity or in an abnormal angle if it falls the leg. Then also we get these kind of injuries. We get plantar fasciitis when the arch of the foot that gets inflamed. We get plantar fasciitis. We get the front part of the thigh. Along with that, we also get certain conditions where we have problems like we get at the base of the foot, that is tendo-Achilles, which is the longest tendon which connects the calf muscle to our heel. Tendo-Achilles, that might get strained. So these are a few commonest injuries that we generally get when we are playing. So the remedy is we should be aware of these conditions. It might happen any moment when we are playing. So we should be aware and we should follow the principle of rest. Rest is there along with icing, compression, elevation. So the dictum is RICE. Icing, compression and elevation in any kind of sports injuries will always help for the first 72 hours. It's very effective. So we should always try to listen to our body and should not be playing like in pain. That can be really vulnerable for your structures. We should be icing it every 2-3 hours whenever to numb the area to keep the pain nerves at bay. So that can be done. Along with that, we can do certain movements like as per the guidance of the physical therapist. If we are injured and if the pain is not settling in 72 hours, what can be done? They'll guide you. You should compress it properly. Basic stretches, exercises that will help you to cool down, and automatically you will be less vulnerable to get injured. So these are few tips you need to follow if you're into some kind of sports, and you'll be absolutely fit and fine. Thank you.